Next, I want to introduce Matt Puglisi. Matt is the Executive Vice President of Business Strategy at Aptima, where he's responsible for developing Aptima's corporate strategy and has extensive training with the U.S. Marines. He's also represented membership in trade associations before Congress and the executive branch, and has served on expert panels convened by the IOM and the Department of Veterans Affairs. In addition to his military service, he holds a master's in public policy from Georgetown, a BA in political science from Siena College, as a member of the Society of Simulation in Healthcare, the Marine Corps Association, and the Naval Institute. So broad perspective, a lot of experience, and you're going to talk to us about integrating patient perspectives and policy.
Thanks.
So thank you.
So I was thinking about what I'd be talking about this morning, and it's going to dovetail very nicely with what my colleagues talked about. What I want to talk about is revealing the hidden state of the system. Everybody today, and we all know, the healthcare system and the VA is very complex. But there's ground truth to what is actually happening. We just can't see it. But with technology, we may be able to discover it. And hopefully, by doing that, we could share what we can see with the human beings that are stuck in this system, the providers, the staff, the patients. And so before I talk about that, I want to talk about the internet. So Aptima is a company that focuses on human factors engineering. Our founder, in fact, has the same Wisconsin accent as Pascal, Danielle Surfety. And we are performing work for DARPA, among other places. DARPA, the Defense Advanced Research Projects Agency, the true inventor of the internet and stealth technology and some other really interesting technologies that we use today were invented by DARPA. DARPA has a program called Plan X, and some of my colleagues are working on that program. Plan X seeks to create visualizations for human beings of the internet so that the commanding general of Cyber Command and his warriors can fight a cyber war. So if you think about it, the internet is infinitely, almost, dynamic. It changes every second. The internet has packets of information that are transmitted via all across the electromagnetic spectrum, right? Electricity on copper wires, light on fiber optic cables, radio energy that's transmitted to and from satellites. What the internet is not a circulatory system like we have, or the electrical grid, because they're very static, or relatively static. The internet is constantly changing and shifting. So up in Cyber Command, just up the road, up the Baltimore-Washington Parkway, they have a map of the world, which is useless, because the world isn't where a cyber war is going to be fought. It's going to be fought on the internet, whatever that is. So human beings with our eyes and our brains have to see in order to make decisions and understand what's happening. So for those of you who are history buffs, if you think about the Battle of Gettysburg, and day 2 is a 3-day battle, and Robert E. Lee's in one headquarters and General Meade is in another, and they had maps. And they kind of knew where they were. They knew what the Earth looked like, and they knew where the enemy forces were arrayed, and they could then talk to other human beings standing around the map and make decisions. And then they fought a battle, and thank God Lee lost. But they understood the hidden state of the system. And indeed, it wasn't hidden. They could see the other guys because they weren't that far away. They could get reports from other human beings who could see where they couldn't see. They could put it all together, put it on a map. The Commanding General of Cyber Command can't do that. He can't see. And so we, with other companies, are working to design a system for human beings, because the internet wasn't designed for people to see. It was just designed to have a networked communication system that would survive a nuclear war. And in fact, the internet wasn't designed for anything we do with it today, practically, right? We watch movies on it. We control power systems with it. We do all sorts of stuff today that the inventors of the internet didn't design it to do, but we're stuck with it, and we got to make it work. And as I said, Cyber Command and DARPA are trying to create a system that fits the way that humans need to learn to see, literally to see, and then to make decisions. All right, now let's talk about the healthcare system. The VA is part of the US healthcare system, and that's too bad. The US healthcare system is as poor a design as one can imagine, right? So if beer is evidence that God loves us and wants us to be happy, then I don't know what the U.S. healthcare system is evidence of. I mean, certainly not that. And the people who work in it didn't design it. And in fact, they're kind of stuck with it because it was never designed or created, right? It's just kludged together year after year, decade after decade. You know, price controls and salary controls in World War II, and then we have all proliferation of employer-based coverage. And then Medicare just covers older Americans. Medicaid covers poor Americans. And then DOD covers people who are only on active duty. It's opaque and it can be dystopian to the patients who have to navigate not only their illness or their loved one's illness, but how am I covered? Who's going to pay? Who can I see? And in fact, we have hospital systems, and again, not by design, where a patient can go to a hospital and it's in network, but the providers in the emergency department aren't. And then you may have read that article in the New York Times, and there are other examples as well. So the system is incredibly complex for everybody, and we wouldn't be having this session if people were generally satisfied with the way it was designed. And again, just to emphasize, it's not good for patients, and it's not good for the people who work within the system. The VA system was not consciously designed either, right? So it's part of the U.S. healthcare system, but there wasn't a genesis of VA. You know, there was, one day there wasn't a VA, and then there was. You know, we had the Civil War, and we wanted to take care of the many wounded veterans who survived and wanted to take care of their orphans. We had systems to do that. And then the First World War. But the VA really today, as we see it, comes from World War II, when we had 1 million service members who were wounded and survived. And what were we going to do with them all? And the Army had hospitals, and the Navy had hospitals all over the country. And after the war, the VA inherited many of these physical buildings and many of the people that worked there. And then we had the VA, and then it became a cabinet post later on. But it wasn't designed to take care of veterans. As years have gone by, Congress has added different categories of veterans who can get care at the VA. That in and of itself is incredibly complex, right? So we have 21 million veterans in the United States, plus or minus, but 6.5 million or so get care at VA, right? So when we talk about the patient population at VA, we're not talking about all veterans. We're talking about some veterans. And many of them are older veterans, right? And then it gets even more complex because the eligibility for an individual veteran depends. Did you serve during a war? Do you have a service-connected disability? How bad is that disability? Well, that affects what care can be provided by VA. So imagine you're the scheduler or you're the admin person and a veteran comes in and they want to get care. You have to figure that out. It's incredibly complex. And many people who work for VA have a tough time understanding the different interactions between the variables of who's eligible and what are they eligible for. So the ground truth is there, but it's hidden sometimes from the VA and certainly from the patients. And then what makes it even more complex is many veterans have multiple payers and eligibilities outside the VA system. Some are older and now they're eligible for Medicare and VA for one reason or another, Medicaid and VA, private health insurance and VA, right? And so, and then there's relationships between, if they're eligible for Medicare, maybe they are poor, and maybe they have conditions and situations that are more prevalent in that part of the population. So David talked about understanding the why, and I wanted to talk about that just for a minute or two. So I talked about the hidden state of the system. There's a ground truth. There's a reason why there's a wait, either when you're sitting there or between one appointment and another. There's a reason, and it could be knowable. But usually, none of the human beings involved in the situation know why. They just know you can't see somebody for 3 weeks. But that now, in a situation that could be very anxious for the patient, for the caregiver, they don't understand many times, well, what does that mean? If I can't go see somebody for 3 weeks, now what? Do I need to do anything or not do anything? Does this matter? Tell me more about why. and tell me more about the why as it affects me or my mom or whomever. But often the person on the phone or the person you're facing with doesn't know what you should do. Look, you want to see a specialist. Specialists are all booked. None are available for 3 weeks. If the patients understood the why, and if the administrators understood the why, and the now what, patients probably could start to behave in ways that improve outcomes. But if they don't know why, they may behave in ways, do or not do things, that decrease the chances that there's going to be a good outcome. So there's something in it for everybody if we can discover the why and present it in real time to the human beings who were involved in that interaction at that time. Okay. So going to the hospital is sort of like deploying. I served in the Gulf War, not in the current war in Iraq, or it was over. It's sort of over, starting again, I guess, or Afghanistan. But going to the hospital is sort of like deploying, right? So first of all, going to the hospital or doctor's office. I don't know if those of you who have heard this, Lieutenant Colonel's probably heard it, but hurry up and wait, right? That phrase that's associated with military service, hurry up and wait. Many people in the military, most of the time, sit around and wait. And they don't know why, frequently. Now, there are some people who do know why, or could know why, but they're busy trying to get things moving again. But hurry up and wait. Furthermore, someone else is completely and utterly in charge. They have absolute control over you and maybe even your life. And that could be true depending on the situation in a hospital, and that's certainly true when you deploy. And in some cases, it's the providers in the hospital, multiple providers, right? One after the other, trying to fix maybe different pieces of your disease. And of course, in the military, it's officers and senior NCOs and stuff like that. The disease is kind of like insurgents, right? So they're trying to kill you. The disease is trying to make you sick or kill you. And then the admin staff is kind of like the civilian population, right? Are they on my side? Are they not on my side? I really can't tell. They probably don't know either. And then the providers show up and they speak in a foreign language, right? That the troops don't understand and the patients don't understand. Hi, here I am, and then after that, it's really indecipherable. What did they just tell me? MCI, what's that? I thought I had a heart attack. Now what are they talking about? Did something else happen? And often the context goes unexplained, right? What is happening to me now? What's going to happen to me later? What should I do? And that breeds anxiety. It also can contribute to errors. And again, it doesn't give the patient the power to affect the outcome or their caregivers to affect the outcome. So, deployments can be dystopian, certainly, but going to the hospital can be as well. And that's not why people become medical doctors, I'm sure, or nurses, or work in a hospital. They don't want it to be that way. It just often is that way. So if DARPA believes that technology can uncover the true state of the internet in real time and dynamically, just second to second, this is what the internet looks like. This is what our enemies are doing. And our enemies, when they fight us in a cyber war, they're not going to drive trucks across the border or anything like that. We're not going to see it. But we have to look at proxy signs to detect an attack. And we're going to have to conduct attacks of our own that go undetected. But we can't see anything right now, which is why DARPA started this Plan X program. If DARPA believes that's possible, then certainly we can start to leverage technologies to provide more insight and more information, not more data, right, because we don't need more data, but more information about what's happening. And I think that by doing so, patients, providers, and those involved in the system can perform in a way that represents flow, as Dr. Kaplan talks about. The system can really operate and supply and demand can be in equilibrium, as it were. Equilibrium not only across a period of a month, but even day to day or hour to hour.